After being a neuroscientist for a couple of decades and spending time as a principal investigator at the Psychiatry hospital in Zurich, I've come to realize that there's so much information in neuroscience that has yet to be translated into how we deliver psychiatry. Currently, it can take months or even years to identify what is the appropriate treatment for a patient with a mental illness. What's really exciting, what's exceptional about Mobio Interactive is how we use computer vision and AI to extract biomarkers from the human face and then leverage that data in order to objectively quantify brain states. What we're really doing is we're releasing the tension that has historically existed between the ability to personalize and the ability to deliver psychiatry at scale. At the Center for Addiction and Mental Health, we're delivering our platform, AmDTx, to psychiatric patients on waitlist in order to facilitate remote patient monitoring, clinical decision support, and give these patients something immediately that they can leverage to take control of and to help support their own mental health.
By providing people a self-guided tool that can actually teach them some really great skills to, be more mindful, regulate their emotions. We hope that will keep them engaged while they're waiting for something. And then as they get into their program that they've been referred to, that they'll hopefully continue using it as well.
We really have two expectations. One is that the base platform that we call AmDTx, it is able to support patients by giving them resilience tools and the ability to measure how they're doing it in an objective way and compare that to their own assessment. The second expectation is for us to be able to deliver actual treatment, and those are our clinical interventions that are unlocked on top of this base platform. So we have that nice infrastructure which enables us to really reach a lot of patients in an efficient way.
The potential of the Mobio Interactive platform is that people can sort of do something that will help their mental well-being while also feedback information to clinicians. And so we hope to sort of break down that barrier where we have to continuously ask our patients to do something. But I think the interesting part about this type of platform is it automatically kind of generates some of that information. It would really help us clinicians understand how that person is doing without having to subjectively ask them every week or every 2 days, or we bother them a lot for this information.
When we're talking about new areas of interventions, what you need is an ecosystem of change. It starts first with being able to identify a target population of individuals who have needs for and are receptive to better care, have a set of clinicians who are embracing new models, who look at what we've done in the past isn't enough, and they're open and willing to be able to try things out with, of course, with evidence behind it. And then the third is being able to have the tools that are able to then scale and go across this new change that's happening in transformation of healthcare.
Well, CHEO is leveraging the Mobio platform in different ways. We are using AmDTx as a psychotherapy preparation tool. So patients who are roughly a month away from entering into a program are given access to the AmDTx platform in the hopes that this will kind of prime them for their clinical treatment while also providing them with critical resilience training. We're also using the Mobio platform for other research, one of which is being conducted in an acute concussion population. The goal here is to increase resiliency and teach these children how to manage their stress and symptoms, so pain symptoms and emotional symptoms, in order to prevent rates of persistent post-concussive symptoms.
Moving to personalized health. And that includes things on the treatment side to personalized medicine, and it includes integrating technology to bridge to the last mile of care, which is one of the hardest challenges that exists in private health and public health.
The biggest achievement that the company has done to date is really being able to prove that all of our tools that we've built up in order to deliver precision psychiatry at scale actually works. Ultimately, we want to be able to have precision psychiatry available to any patient anywhere in the world that needs it. That's the promise of Mobio Interactive. Precision psychiatry at scale.